Hello, guys. Hello, family. Thank you for coming in. Today, we are going to continue on topic on diabetes. And I believe that the last episode you enjoyed yourself. Thank you for coming in once again. God bless every one of you. Amen. So, as we all already laid it before, what is diabetes and the how it kills and the causes, we said diabetes is a disease that occurs when the blood glucose, also called blood sugar, is too high. Blood glucose is the main source of energy and it comes from the food you eat. Insulin, a normal meant of the pancreas. So we were able to establish the fact last week that there are some fruits that you eat that will be beneficial. There are some things that will do that will encourage for the diabetes to go off. Okay, we talked about the primary symptoms. We talked about it increased taste. You want to drink water, fluid, and other tastes. Okay, if frequent urination, you want to go to toilet to pee, and extreme hunger, you want to eat anything. You might eat bowl of eba. You come again, you want to eat. So that's the primary symptoms that we get from a diabetic patient or unexplained weight loss. They lose weight. So we just want to know that. And we need that fatigue, so tired, and something get irritated to them. So it's another basis for us to know. And we discussed the last one about the six symptoms, the diabetes warning sign. Okay. So it's very important for us to do the six symptoms of diabetes. SS test, that's what we talked about. The blood vision, increase of hunger. Sometimes your eyes will be seeing double. This is what we are talking about. We are talking about diabetes part 2, unexplained weight loss, the fatigue, and it's so there now we don't even know what we are doing. So we talked about the 6 common diabetes warning sign that we must look out for, which is very, very important for us to work with. It's very, very important for us to work with. Below we discuss and other things sign. Number one, increase of urination. We should be aware of it. Don't just pay on attention to so many things, who is talking, who is not talking. Diabetes kills this period and it's difficult for every one of us to notice it. Diabetes is a disease that make it difficult for you, your body controls sugar, your glucose, and it's very difficult for you to hold on pee. Okay, so it's using the kidney. It flush excess glucose from the body by eliminating through urine. So you drink water, you do anything, you just go to the toilet often. It's a very bad sign and is a warning sign that you have diabetes. The result, increased urine production, increases and the need to urine more frequently. Okay, you now become like a pregnant woman that once when is pregnant wants to go to toilet, urinates when it's due. You see, for many women that are pregnant and have given birth, you understand what I'm talking about. If you notice that you are not getting the urge to go to the bedroom more than often you used to, it could be a warning sign of diabetes. Okay, this is especially true if you are having to get middle of night, one of multitude of it, to go to bedroom. We should be sure and aware of what you're doing. The second one, we talked about the excess taste. There is this taste and urge for you to deal with increased blood sugar. The body will actually put water from cell to other dilute the blood. Okay, the body pulling water from cell leaves the cells dehydrated. You should know it makes you tasty and all that. Along the body producing and eliminating. It's very important for us to know what we really want and what we intend to do. Okay, so very, very important. And I want us to understand something. These are just the warning sign. The blood vision, as mentioned, increased blood sugar level. So when the sugar level is increased, this is where you notice all those little symptoms in the body. Searching for fluid to balance blood sugar level. One of the places the body could pull fluid from is the eyes. Okay, so the result is swelling of the lens here of the eyes, are causing blurred vision. You have problem in seeing. Sometimes you just see, you're seeing double. Sometimes your eye keep turning you, so you just know that diabetes. For diabetes, blood vision can come and go along with blood sugar level. Okay, if you are not noticing your eyes and blood pressure, so this time you must know, but it is better shortly after eating. This could be a sign of diabetes. Okay, so we are just bringing tips for us to understand. If you are not going to see the doctor, you don't know what is wrong with you, these are just few tips for you to understand what it is. Increase of hunger. You want to eat, still feeling hungry after you eat. You've eaten some bowls, you've eaten, and you still feel hungry. As soon as you remove your hand from the last meal, you are still wanting to get more. It's a sign of diabetes. Okay, unexplained weight loss, all of a sudden your waist drops, is a sign also like that. Fatigue, when the body isn't getting enough energy it needs, you are going to feel tired and less energy. So most of us just, I'm so tired. Why don't you go for checkup? Go for checkup. Don't assume. Assumption in taking self medication is a very bad ailment. It's a bad disease. It's a bad thing to do for you to do self medication. Just go to your doctor. He or she knows what to do. Okay, so it's important for us to understand this tip, for us to know what we are doing. So enable us also to know the very vital key of what we are going into. So it's important for us to understand it so that we'll be aware of it. So diabetes kills a lot, and it's making us to go so fast in it and cannot even understand where we are going or where we are coming from. So be careful what you eat. Okay, be careful what you eat. We talked about the type of food that are good. We talk about the nuts and all that. So it's important for us to understand that something is good and something is coming. So there are main three types of the diabetes we know. Main three types. He said we have the polydipsia, okay, which is the polyuria, okay, and the polypia. These terms correspond to increase in taste, urination, and appetite. So these are the three combined names that we see, and is still helping us for us to understand what it is. Okay. We said last week, can diabetes go away? Why diabetes is uncurable. A person that can stay remission for a long time, no cure for diabetes. It only go for an holiday. Holiday in the sense that you take care of yourself. If you take care of yourself, then it might just go for a while. Nobody will notice it around you. Okay? So there's something I want to talk about. People keep asking, can anyone with diabetes eat bananas? Okay, for most people with diabetes, fruits, including bananas, are healthy choice. Although if you are following a low carb diet, to manage your diet, even a small banana contains around 22 grams of carbs, which it increase the level of diabetes. Okay, which may be too much for the eating plan. Some fruits that are not advisable for you to eat at all, at all. Okay, there are some fruits you cannot eat. So these are the ones that contain sugar. We cannot eat. We cannot eat it. So it enables us to go further. And I said something last week about some food we can actually eat. I talked about green leaves. You can actually boil them. Look, when you are frying your green leaves, you are boiling them. Don't let it be more than 3 minutes. Okay, even if you are boiling, even if you are excusing it, because by the time you cook and cook, the nutrients are all gone and you might not understand what it is. So the nutrients should be in there. So it's very, very important for you to fry and cook or boil in a very 3 minutes, 2 minutes is okay. So you need to eat the green out of it. We talked about avocados, which is the pear. In Africa, we have different type of pear. But I'm talking about the big and the fat one. It's called the avocados, and it's what is very good. Slice and eat is very, very good. I talked about eggs last week. The eggs, I believe that the frying, no, I'm just more concerned about the boiling. And I believe that you boil, not overcook it as well. You can boil to the level where everything is done and you bring it out. I talked about beans. It's very important. We have the white, black-eyed beans, the brown beans. Those that come from Africa, Asian continent. We have different varieties of beans. Beans are the species that are very good. Okay, it's very good for those that are having diabetes, and also too, we have a lot of beans, a lot of beans, a lot of beans, but they are very good. Here in Europe, you have the ones that they've already parboiled, that is in the can. You can just make use of that also. It's a very good process when it comes to beans. The species is very good and they have nutrients also. We talked about the nuts. We have the granules, the walnut. We have nuts that are also good for the patient that have diabetes. Okay, so it is very important for us to understand something when we are talking about it. What does high sugar feel like? High sugar feel some like this. If your blood sugar level is too high, you might experience increased taste, frequent urination, and fatigue. So these are the basic things where we can understand where most of us are going. Okay, so someone asked me and sent me questions. I'm trying to bring the DM out from it. Said, can diabetes affect sexually? So that's one I'll be able to answer in a little bit of my understanding and what I've read so far. Okay, so we are going to treat that one now and see how it is. Diabetes, the neuropathy, is a type of nerve damage associated with diabetes, can cause sexual issues. Okay, numbness, pain, or lack of feeling can also occur in genitals. This can lead to erection or dysfunction. Neuropathy may also inhibit organism or make it difficult to feel sexual stimulation. Yes, these are the types that can affect. Not all that can affect, but this very particular diabetes, which is called the neuropathy, can affect sexually. So it's very important for us to know where we are going. Very, very important for us to do that. Okay, so diabetes and sex of men, issues on women. We understand that diabetes is not only on men. It's not only on the issues of men. Women also, not only the issue of women rather, but men also are having diabetes. So it's what we should understand and work with. It's what we should understand and work with it. So it's a very good thing for us to know the type of the diabetes we are talking about. Having said that, it is not that advisable for you to go on believing what others have said. Go for a research, go for a research and see what you can do. Go for a research and see how you'll be able to help yourself. Go for research. Don't assume another person's case is worse than yours. No, don't assume. If you assume it, it doesn't make sense. So you must walk through and know what you really want when it comes to diabetes. Having said that, it is an important fact that we must understand this thing, that diabetes kills mostly in women, even in men. It's a very rampant, rapid disease that kills this time around. So we should be very careful on what we should do. So what are the fruits we should avoid when it comes to diabetes? Fruit is also an important source of vitamin, okay? It has minerals, it has fiber. However, fruit can also be high in sugar. So we are going to list some fruit that is high in sugar. People with diabetes must keep a watchful eye on their sugar intake to avoid blood spot spring. Okay, so that is what we're going to talk about. There are some fruits that are not good, that should be avoidable. Okay, there are some food that should be avoidable for us to know what we need to eat. We cannot just see somebody eating a banana. Is it good? You jump because they say fruit is good. It has vitamin. It has mineral. Is it good for you that have diabetes? You don't jump and follow people's way. You don't jump and follow people's way. It might not end well, but it might be a sign of you trying to make something do. Fruit also makes an healthy option, both as a snack and as a part of balanced meal. It contains many potent things that we can do with fruits, okay? Many important nutrients, such as fiber. However, some fruit have a high sugar content, which can cause blood sugar to spark, okay? Which can cause it to spark. For example, the National Institute of Diabetes, Digestion and Kidney Disease recommend that people with diabetes include fruit as part of a balanced diet. Yes, you will increase fruit as part of a balanced diet, but be careful with the kind of fruit that you should eat and the ones you should avoid eating. So that's what he said. Eating fruit and vegetable might put a person at lower risk of developing heart disease and cancer. Okay. However, fruits that can be eaten are so numerous. We talked about, for example, you want to really go, baked good foods are very good. They are very good. There are some fruits we get in cans. Yes, it can be in natural herbs. It can be what we need to do, but we need to understand something, that some fruit can be avoidable with other means. Okay, fruit high in sugar are watermelons. Watermelons are not good for diabetes patients, not at all. Watermelons, they are not good, okay? So avoid it, because when it comes to, we are about entering summer, or part of Asia or Africa, we're already in summer. The watermelons should be avoidable by all means. It's not a good fruit for you to eat. Don't feel so tasty and have the longer throat and somebody just slicing. You just want to be there. No. Overripe banana should be avoided also. It's not to be taken at all. Overripe banana is not a good one that should be taken at all. The next fruit you should run from is pineapples. So as you are measuring it, still so yummy, sweet, delicious. You just cut it and stay on your snack home and everything is good. But there is something that you must know. It is a food that has a G health score of between 70 to 100%. It is very high in sugar. Okay, it is very high in sugar. So watermelon is very high in sugar. You are running for sugar, you are eating sugar. Pineapples, overripe bananas are not also good too. They are not also good. So these are the three ones for now that I can come up with. Okay, that will be able to help us out in whatever we are doing. So when we are doing a large banana, it has to be 30 grams of banana you would take. Okay, so it's not overwrapped one, just normal is what you can take. Chocolates and little cakes can be well, but 55 grams. Okay, so there are medium apples. Apples is good too, but 15 to 20 grams. So you just cut it a little. Don't over exaggerate it and say, okay, I want to eat this. So it is a column where we must do it. Fruit juice. State that drinking fruit juice during a meal or is quick raises a person's blood sugar. Fruit juice are not good. Okay, so it raises your sugar level, and if you are not careful, it allows you to go on in another term that you cannot do what you expect to do. So diabetes, we can find it in children, we can find it in teenagers, we can find it in women, we can find it in men. So we should understand the fruit we are able to take, okay? So I just bring it down. When we talked about a fruit that is not good for diabetes, last week we talked about the fruit, the nuts that are very good, and I also explained before I went further for the fruit that are not good. When we talk about nuts, we talk about green leaves, we talk about vegetable. God has blessed us so much in the other part, in Africa, Asia. God has blessed us with green leaves, even here also. So we take the green leaves, and I said there are some you can squeeze and just drink the water. There are some you just parboil, not more than 3 minutes. Because by the time you parboil, start cooking, the nutrient and everything is gone. So it's not good for, there is no purpose for it, you boiling it There is no healing process in it again. So it's as if you've not done anything. Okay. So we now move on to the fruits that are not good, because they have sugar himself, and you are battling with sugar, so you need to cut off watermelons. I know it's yummy, it's delicious. By the time you see the slice, you just, especially when you see the one that are very good, that are not bitter. There are some watermelons you cut, your cheeks here, you will do like this before you start eating. But there are some ones you just put so soft, so delicious and yummy. We know is tempting. So you must avoid watermelons. So you must take bananas, but in a very, very small quantity. That's what we explained before. Apples are good also, but in a small quantity, 15 to 20 grams. So sometimes people say, not be punishment. It's not punishment. Oh. You are trying to take care of yourself. You are trying to live longer than it must be. You're not trying to just step aside and know that this one is not good. No, you're not doing that. But for that moment, you are just trying to take care of yourself, which is the vital thing for you to be healthy. Okay? So we talked about pineapples are not good as well because they have sugar in it. So you are battling for sugar, you are adding sugar through fruit. I understand. You want to take fruit because fruits are good, but you must look for the fruits that are good also. We talked about even the banana not unwrapped, but wrapped, not overripe, okay? Just the medium. You can have 30 grams of banana, very small, in a very small quantity. Okay, so when you're serving a dry fruit, like you have the nuts, you have the mixed fruits that you can eat, not more than 20 grams. Okay, so it also help you for you to understand what it is to eat little portion with what will help you enhance your health. Your health is very, very important. Then we said fruit juice during eating is very wrong. Some of us don't like water again. Even beside those that don't have diabetes, by the time we just eat, on the table there is juice. Those that is going for aperitivo, we call it the wine, the juice, they just begin to take. Many of us have lost the appetite of taking water. Whereas water is very good. Water is very good, very, very good for the body. Okay, so packaging. When the AD suggested that people watch out for certain phrase or product labels, it's packaged, and there are some dragons, and there are some things that are not good that they packed for you, called dry fruits. So if you want to really do dry fruit, you get this fruit, dry it yourself. It can be a food processor that have this drying, or an oven or whatever, dry it yourself. Then you want to still have a lot of fruit that you can process yourself as fruit juice, like the apple, without adding sugar. You just process it and make it natural. So it's very good, but in a very small quantity. So if they say we should eat 15 to 20 gram of ample fruit, so I want that the liquid has to be very small too, so that it doesn't boom our system, so that we not get carried away because it is juice. So everything you must eat at this moment has to be very moderate. Knowledge is power. By the time we just keep doing this, we might not have any alternative to do what is supposed for us to do. So it's eating is very alternative, and we must do it. So pear is also good, but in a very small quantity. Pears is very good. Then orange is good as well, but in a very small quantity, so that we don't get into what it needs to be. Okay, so these are the things that we must run out from, so that we will not complicate things. Okay, so the plates they give you, plates method. This diet include one small whole fruit of half a cup of fruit salad. Salad is also good because they are green leaves, so it's very good. Among other food, it allows it. Okay, so when you go to the carbohydrate, it might be a frozen fruit, and it shouldn't be more than 15 grams. It's very good as well. When you come to the fruit also, the GL, it enables you to balance your dieting system, but you must understand that it is very good for us to follow the column of diabetes manual. Don't say no for a long time. My diabetes is recessed now. I don't think I can do that. I don't think I can do this. Hey, it is very dangerous. So the AD lists several common foods that people with diabetes may have in their diet. This includes apples. I've said it before. The apricots is good. The avocados are good. Bananas are good, not overripe. The blackberries are also good. The blueberries are good. And the cherries are good. The grapefruits are good. The grapes themselves are good. The honeydew melons, not watermelons, the other melon that look orange inside is also very good for you to go with it. Kiwis is also good. These are some of the fruits we cannot get in Africa, but we have it here. Mangoes are also good in a very small quantity. And I said about oranges too. They are very good in a small quantity. So you don't feel because they say mango is good. You carry this big one, you eat. Orange is good. After dropping mango, you carry orange. After doing it, no. It has to be eaten in a very small portion because it also has nutrients, vitamins to help you generate those systems that wants to fight it. Okay, then we have also the ones that are good, pears, pineapples. Pineapples are not good because they are high in sugar, but there are other ones that they have in cans and all, so be careful the way they pack it for you not to be able to know what to do. Okay, so strawberries are good, raspberries are good, so very little quantity, you must have all these portions, and it helps us to enable us to do. In a summary, fruit consumption is an important part of a person that has diabetes. Though fruit have a normal routine that can help us stimulate our system, but you must do it in the right form. Okay, it has a large amount of sugar, depends on the fruit. Fresh fruit does not contain free sugars, which are in some other places. So it does not contain free sugars, okay? And also, it can affect a person's blood sugar. So be careful with the kind of fruit that you eat. So it's not like I feel like eating fruit. Look for the fruit that is advisable for you to eat. Having said that, knowledge is power. I keep repeating it. Knowledge is power. If you don't have this knowledge, don't let people's treatment be your treatment. When you see any symptom and you see something that is not good, quickly go to your doctor and let him give you a piece of advice for you to do and to work with. So it's important for us to know where we're going. It's important for us to know what we are doing. Now, what I always do is in the pidgin language, if you know, say you get diabetes, not join other people, they take their own treatment too. Your own na to go see your doctor. Oh, doctor, I dey feel like this. Oh, wetin I go take? No be say Mrs. Lagbaja come meet you say im get diabetes. Oh, im doctor write so thing for am. Okay, you now say, okay, give me the paper. Me too, I wan do. Give me the paper. Me too, I wan do wetin I wan do. If na so, me sef wan do this one. You go give you the paper. You go come go pharmacy. You go come go buy wetin dem no send you. No, e dey very dangerous. So the fact say you dey take care of yourself, so for that moment now say the sickness not come show, nothing come show, nobody dey even dey notice say you get diabetes, no mean say anything wey come your way you go eat. We dey talk about fruit just now. Pineapple na wetin you no go fit take because e get sugar. You know say you too dey fight make you comot for sugar, you go put sugar join am. Na very dangerous thing. E no good at all. So e no good at all. So e make you yourself work to get to where you need to be. Because we dey follow people always. When they say na A dey happen, we go follow A. Na B dey happen, we go follow B. Na this one dey happen, we go follow this one. For us, e no make sense at all. So now, the fruit wey we fit eat now, na be even watermelon, you no fit eat am because e get sugar. So you fit take apple, but na small one o, 15 to 20 gram, na im doctor write o. Or for those one wey dey give us timetable on how to eat our fruit. Fruit dey good, but you must know the kind of fruit wey you wan dey eat. So that kind thing go always help you. Not assume say since dem say make we eat apple, carry full big one too, you eat it. No, that kind thing dey bring damage to health. So you must follow the manual, which is the instruction wey doctor say make you follow. Mangoes too still good, but na very small one. Kiwis, We have strawberries, we have barberries, we have very good ones wey still good. As I talked that last week, green leaf dey very good. We dey have the ugu, we dey have the spinach, we have watermelon, or this water leaf. These are all of them are green leaf. So the method go good for you, even if you take am, e go dey very good for your body. Na number one, you go peel am, you go pick am, wash am. If na the one you wan squeeze, you wan drink, e dey very very good. Then if na the one wey you slice say you wan boil, no let am pass 3 minutes, because anything wey make am pass 3 minutes, all the nutrient don enter water, and before you go take time to dry, you don dey cook this thing for 30 minutes, and e no go dey okay for wetin you wan use am for. So another thing is, na two type o. So when we dey do all this thing, we know wetin we dey do. Somebody ask me say, e dey affect sex? The one wey I talk for the normal English be say, e get some way yes wey dey affect, e get some wey no give you urge. So our prayer be say, make we no come in contact wey be say we come get this diabetes, we go dey struggle. So now, no follow people waka the road wey dem don waka, but rather you waka the waka and the road wey you know say e go clear for you, so that this sickness go heal. No, the sickness no fit cure. Dem no be permanent one. Be say e no be like some other sickness wey be say you take tablet, you eat, and those disease go comot. No, this one no dey comot. But the more you take care of yourself, the more those things dey go holiday, the more those things go go hide. So if you no take care of yourself, e come back. So that's why you must know wetin you wan do. So for some people now, because they say apple good, the fruit drink, the juice, we just carry full gallon with the drink, e dey very very wrong for our health. E go still cause damage to our health. Water na be the best thing. If you know say, even when you no even get diabetes, even if we no get sickness, water dey very good, make me and you dey take. Because by the time me and you dey take that water, e dey function for our body o. Our system dey work o. You understand? Water now for body go wash everything, especially for night. Keep water close to your bedside. You must, the doctor advise say make we take 2 litre, the one wey big small, you go take am. But many of us, e dey very difficult for us to even take half a 1 litre, because all we just believe say na coke eat, fanta eat, all those things na sugar. So even if you no get diabetes, you run from those things, okay? Put water for your bedside. At night you can drink, so when you wake up in the morning, you go wee wee, so those things now go still flush am. Take another water, you flush all those things. You know, when you go toilet, you flush, maybe everything go turn to plain water. Na so e still be for your body. You go watch am, everything, you no go hear anything again. So water is very good. We dey talk say water no get enemy, and na true. Water fit fall on anybody, you fit use am do anything. But wetin we dey talk be say, drink water. All those juice, all those fruit, all those things, e no go feel good. There are some food too, we know, if you know say you get symptoms, three things. So many things dey, but three things wey you know say you go take know say you get. If your weight, you fat before, all of a sudden, don't be say you sick, you don come down, you need to go check your doctor. You dey go to toilet always, you need to, you just eat one full bowl of food now, you don dey hungry, you need to go, or you dey very tired. Anything wey around you just dey make you feel somehow, so you need to go check your doctor and know wetin dey. Having said this, diabetes is incurable. Make haste and make sure you take care of yourself. Don't assume that all is well. Don't bring faith into it. Don't bring faith into it. When you need to take care of yourself, take care of yourself. When you need to go for a checkup, go for it. Don't say my faith does not allow it. You will just die there. So be careful and take care of yourself. And as you do, God bless you. Okay? So I come your way next week. We are going to talk about an important something we use in cooking that we don't know that it has a benefit in it. We don't know it has a benefit. So next week we are going to talk about okra. The use and the benefit, the nutrients, everything in it, and how important it is for us to use it. Okay? It can be used in so many ways. So I'm going to give you next week the tip of the use of okra, so that we'll be aware that something good is coming. Okay? Thank you so much, and God bless you. Until I come your way next week, be prepared for question. Go to my comment box, and if you want have a question, leave it there, or you have a personal topic you want us to pin ourselves to, like, come out from it, helping ourselves to go in. So next week I'm going to be talking about the benefit of okra, the nutrient, the ingredient that is in there. Now most of us just used to cook, but we don't understand the nutrient, the vitamin, the minerals that are in there. So next week I'm going to be unveiling the importance of okra. Okay, if you have not yet subscribed to my channel, Lara All, subscribe to my channel. It's very important for you to do that, so that when we are uploading, you'll be the first. Just press that button. You cannot be watching and don't press it. So share us out. So it's important for us to know, so that others will be aware that we are doing healthy tip every Tuesday. So I pray that God bless you. Thank you so much. See you next week in good health. Amen. I still remain your host, Loretta. Follow the for all, Lara all in all. Thank you. God bless you. Good night and sweet dreams. Remember, health is wealth and knowledge is power. Stay blessed.